National Orthopaedic Hospital, Igbobi, today officially renamed its Prosthetics Orthotics building after its former Chief Medical Director, late Dr. Francis Owosina. This is in recognition of his immense contribution to the growth and development of the hospital and orthopedics in Nigeria and Africa. Professor Dayo Ejewumi, in his remarks, attested to the fact that late Dr. Owosina was a selfless leader who impacted lives in Nigeria and beyond.
His loving generosity to family and friends and his total commitment to whatever community he is involved with. Today we celebrate that commitment of time, talent, and treasure to the medical community. But that only is typical of the same kind of commitment that he has to his immediate family, to his extended family, and to his home community in Shagamu. With great humility, he gave service to these various sectors in his life. He counted it as a great privilege, which if, for any reason, he had failed to carry out, he constantly said to me, if he had failed to deliver on these privileges that he had, he will feel absolutely ungrateful, and he will feel that he has been derelict in his duties to God, who he constantly said has been enormously and inexplicably gracious to him. Let us remember that we are gathered together to celebrate the life and times of a man who rose from a very humble background to a high position of authority nationally and internationally. Yet, he never wore it on his sleeves. He labored without counting the cost. He served without eyeing the reward. He mentored, not to be admired, but to retire. And not many of us do that. He could easily have sucked for his own benefit the positions, the people, the places in which he worked. Instead, he sank into those places, into those people, into those opportunities his very life. You only have to spend a few hours with Dr. Owosina to know how much he commits himself to other people, to serving, to lifting other people up. Yet, as sound as he was mentally, he was streetwise. He was a practical man, and he knew how to handle resources that were in his own possession for stabilizing his life. That is the legacy that Dr. Owosina has left us, a legacy of riches in goodness.
At the event, the Chief Medical Director of the National Orthopaedic Hospital, Dr. Odunubi, commended the Federal Ministry of Health for approving the name change and described his predecessor as a key driver of the transformation of the hospital.
First, I would like to start by thanking the Honorable Minister for approving this ceremony to take place. We wrote for permission to name the Prosthetic and Orthotic building, and the ministry asked some questions and we provided answers, and they approved this naming of the building. Dr. Owosina took over the management of this hospital at a very difficult time. It was a transition from his hospital being managed by the state government and then taken over by the federal government. It was operating at the time when people used to say, of Igbobi, Owoni taxi. Treatment was free, and all you needed to have was transport to get to Igbobi. But the care was not optimal. A lot of patients were lying on the floor with no bed space for admission, and there was no focus in terms of management. This is supposed to be, and it has always been, an orthopedic hospital, and you had Prof saying that there were annual fees on the list. So it shows clearly that there was lack of focus in the hospital environment as of that time. So he had to come in and rectify all those faults in the system and really redirect the hospital to what it's supposed to do. And in the process, he recognized the fact that he had to get in more people to assist, and that was how the people like Dr. Nobale, Dr. Grange came in. We also had an arrangement with the Bulgarian government for exchange of personnel and consultants within the hospital to improve the level of practice. And more importantly, new methods of treatment, far better than hanging legs all over the place, were introduced into management of fractures. Modern methods of treatment that will make patients get treated without hanging the leg and then go home with the limb length equal and no disability after fracture healing were introduced. And personnel trained and retrained to ensure that this was possible. Apart from that, he also started training programs in the hospital. The residency training program, at a time when people felt only teaching hospitals could be accredited or have facilities that would make them get accredited for residency training, he was bold enough to apply for accreditation from the two colleges, West African College of Surgeons and National Orthopaedic College, and got the residency program started. We can boldly say that in this country today, half of the practicing orthopedic surgeons all over the country have passed through Igbobi at one time or the other. And that's the benefit of a program started by a visionary leader and an astute administrator. And he didn't stop at that. He also went ahead to establish post-basic orthopedic nursing schools. The post-basic orthopedic nursing school in orthopedics and the one in accident and emergency. He had the third one in mind, the one for rehabilitation. And I think the Nursing and Midwifery Council has not been bold enough to start that yet. But this was what he was thinking about 30 years ago as a very important specialty for nurses.
Responding on behalf of the family, the wife of the late surgeon, Mrs. Dr Owosina, extolled the virtues of her husband, which included a compassionate leader, a man who identified with the less privileged people, and a man passionate about his medical profession.
The way that he poured out his life into rehabilitation, the rehabilitation of the disabled was for my husband a passion. It was something he lived for. He brought to the practice of rehabilitation of disabled persons such empathy that went beyond looking at their physical needs. He went beyond that. He saw more into the emotional and psychological needs of these people. It's okay that today we're talking about prosthetics and all those physical things that can help. But he did much more in the area of their lives, the personal lives.
Highlights of the event was the formal unveiling of the Prosthetics Orthotics building in the hospital to reflect the name change. Ma Owosina speaks further on her husband being honored by the National Orthopaedic Hospital.
I believe that he is happy today. I believe that he can see us because Jesus himself said that there is joy in heaven upon one sinner doing penance, which is to say, those who are in heaven see us here. And I believe my husband is in heaven. So he certainly is seeing all this that is happening. He's seeing that the sacrifice he made, the sacrifice of committed life to the development of the profession, but especially to the uplifting and building up of the underprivileged, the handicapped, that is receiving a reward like this today. We are really very happy indeed. And I'm glad that this shows the children, because the children and I were very much a part of the sacrifice he made. You know, when they say he was at work from morning till 10 o'clock, you know what that means for us at home. And even we used to spend Christmas in the wards with the disabled. Christmas Day, the children didn't like that at that time, but I'm sure they now understand better, and that we are committed. We see from this a need to be committed to keep up the legacy of this life of commitment to service to humanity, especially to the less privileged.
Mr. Obioha Ononogbo, president of Spinal Cord Injuries Association in Nigeria, also shared how late Dr. Owosina influenced the formation of the group and encouraged them despite their disabilities.
We definitely have a lot to remember Dr. Owosina because we learned a lot from him. He was so compassionate. You know, when many of us were at Igbobi and the Igbobi authorities felt we were overstaying, but he was the one that said no. He understood our problem more than any other person. He gave us that opportunity to really take our time to organize ourselves, form the association to enable us now have a place we can rely on as a platform to solve problems of persons with disability.
The legacy of Dr. Francis Owosina lives on, and the major takeaway from this event is that Nigerian healthcare sector needs more selfless leaders who will be devoted and committed to its transformation.